professor of clinical psychology and a consultant in the Center for Addiction Medicine at MIMANS. After completing her MPhil and PhD in clinical psychology from MIMANS, Madam did her postdoctoral fellowship at the prestigious Washington University in St. Louis, USA. She has a career spanning over 2 decades in the area of addictive disorders. Her areas of expertise involve development of specialized brief interventions and strengths-based assessment tools for individuals with substance use disorders and addressing personality, psychological trauma and emotions related to harmful use. In addition to receiving the prestige, Madam has received prestigious Wellcome Trust Capacity Building Award. She has been associated with multiple international projects in addiction and has published extensively. She is also affiliated with the cybercrime branch of Karnataka State Police, to which she has reached out to schools and colleges in Bangalore. And Madam has conducted several training of trainers workshops and is actively involved in sensitization of addiction among community stakeholders. She has mentored over 500 students and guided several doctoral scholars, and she abides by the philosophy that each individual is unique and helping them finding meanings in their life stories allow them to thrive optimally. Well, Madam will be delivering a talk on identification, impact, and management of addictive disorders. She will be covering the talk will introduce core concepts related to types and diagnostic criteria for substance use disorders and move on to identifying early warning signs, risk factor, and reasons for substance use among the youth. We'll also address consequences and highlight psychosocial interventions and the existing mental health resources that can be utilized to minimize the impact of addictive disorders. In fact, we are very fortunate that Madam could find time for this talk on behalf of KSTA. Once again, welcome to you, Madam. Now, it's over to you for your talk.
Thank you, sir, for inviting me for this talk. And I look forward to active participation from all the people who are attending. I also thank Professor Bharat for initiating this process and Dr. Ramesh for allowing me to come and give a talk over here. Today, I'm going to be talking about an important area in the area of mental health known as addiction and impact and management of addictive disorders. I'm an additional professor in clinical psychology, and I have now been working in with the addiction population for a fairly long time. I hope that some of these concepts that we'll be discussing today will help everyone to get sensitized to what addictive disorders are and understand that a lot of mechanisms are at play and can actually help individuals to seek the kind of support and help that is required subsequently. The first question that people often ask is, what is addiction? Right at the onset, I would like to mention that it is not a use of a substance that we are talking about, but addiction is a psychiatric condition, which is not the same as substance use, in the sense that there are certain criteria that need to be met for us to say that the individual has an addictive disorder. We have certain diagnostic mechanisms in place, and overall, the definition is that it is a cluster of symptoms, whether it is physiological, biological, behavioral, cognitive, which has a chronic pattern, which means it occurs again and again despite harmful use and despite its consequences across myriad areas. And these cycles are of lapse and relapse. A lapse would be looked at in terms of a person getting back to using a substance briefly, but a relapse is defined differently in terms of the individual using the substance as in a dependent pattern. When we look at the prevalence rates of substance use disorder in India, it is fairly alarming because we find that over 5% of the population have been diagnosed with alcohol use disorders. And that's daunting because we're talking about 5 out of 100 individuals who actually have a disorder. It is not just use. Tobacco use disorder, on the other hand, if you see, it is 21%, which again is indicating that there is a high need to work with this population. We find that cannabis use disorder is fairly underreported. It's 0.9%. But one important thing is that of all these disorders, most of them, or at least 50%, start at adolescence before the age of 14 years, which means that that is the age when we can actually start working with individuals and preventing a use to become a harmful use or a disorder. The National Mental Health Survey further found that there are significant differences between men and women in terms of the documentation. Now, this was a very large scale study done across 12 states with over 34,000 people as part of the study, and it indicated market difference between men and women, with 32.8% of men using tobacco, whereas only 9.8% women reporting tobacco use disorders. Similarly, you can see that alcohol use disorders is 9% among men, but only 0.5% in women. Now, I would like to highlight that these trends are now changing in the socioeconomic sequelae of the Indian context. And we are having the second phase of the National Mental Health Survey being conducted, which will provide us with current data on these percentages. Looking at the types and the criteria for using substances, this is, like I mentioned, a psychiatric disorder. And the first thing is that there is market craving or need to take the substance. It is like an impulse that the person has to take it, irrespective of other distraction techniques that the person has or social support. The need at that moment is high. The other criteria is known as tolerance, in which the individual needs more and more substance to get the same impact that they had earlier. So, for example, if the individual was taking 3 drinks in a day to feel the buzz that they wanted, over a period of time, that becomes 4 or 5 or more and goes on to get the same kind of impact it had earlier. There is also an associated difficulty in cutting down use of the substance with marked withdrawal symptoms, which are physiological and psychological in nature, that happen because of intoxication and then subsequently stoppage of usage. This is very important as clinicians for us to also tell students and people in the community, because the withdrawal symptoms can be intense. There can be complicated withdrawal like seizures. It could be in terms of tremors. It could be in terms of breathlessness, headaches, nausea, vomiting, and multiple other cognitive problems. There is also salience in terms of a criteria, which means that they use the substance across all situations, even if there is academics and deadlines and other things the person wants to do, or if there are some hobbies and activities that engage a person, the substance use take on the most important value in the person's life. So there is salience there, and they use it despite harm that is being that occurs with either themselves, onto themselves, or at the culture at large. We need to keep in mind these criteria when we are looking at substance use disorders, which, according to the Diagnostic and Statistical Manual, fifth version, talks about 10 types of substances. There is nicotine and tobacco, which is the most prevalent, followed by alcohol and cannabis in its various forms, marijuana, there is stimulants, including amphetamines. We have cocaine, hallucinogens, and benzodiazepines like painkillers, sleeping tablets, anti-anxiety drugs. There are synthetic drugs like meth, there is caffeine, there are opiates, again, which are significantly high, like heroin, and inhalants such as glue that people sniff. Now, the way in which people use these could be different. It could be through inhaling, it could be snorting, freebasing, it could be injection drug users, intravenous usage, as well as intramuscular usage. There are also multiple names and combinations of these substances. And I think the younger population today have quite a bit of knowledge about these type of substances, whether it is something that they use to get a high, or whether they use it to calm themselves down. But the bottom line is that there are these substances, and it just seems to be growing now. I'm not talking about online gambling or gaming use disorders, because that will be covered in a subsequent talk. Uh, we need to know about the kind of transitions that occur in individuals as they move into the substance use disorder profile. And initially, it just starts with experimentation with a drug. For example, it generally seemed to be either tobacco or cannabis initially, which is just used for experimentation out of curiosity, out of just seeing how they feel about it, or because their friends are using it to experience the feeling within themselves. But that soon moves into a sporadic and regular usage of the substance, where the person might use it over weekends and use a higher amount than what was being used earlier. And gradually it becomes a dependent or established pattern. So, what started off earlier as just a curiosity to use a drug moves on to becoming a dependent pattern. And that is where I think the role of people like us come into play, because we need to be able to curb that dependence pattern in individuals. I'd like to mention that there are certain early warning signs that can highlight whether the person is having any symptoms associated with addiction. This is for all students and young adults, also apart from teachers and other professionals, to identify if you find that there is any change in the person's behavior or overall life circumstances, then it is a red flag. For example, a person who was doing better in academics earlier, there seems to be a decline, or they are not attending classes as regularly as before. They are not having the same type of group of friends as they had earlier. So there are these association with individuals who are using some kind of substance. We have these groups within a college or an institute. In fact, marijuana is very well known to be part of a campus culture, which we need to actually move away from. uh, there is a lot of isolation and withdrawal that occurs as a person stops using the substance in the company of others and starts using it in a solitary manner. Hygiene, taking bath, getting up on time, sleep wake cycles are all things that one needs to be aware of. Sudden anger outbursts, lack of self control, mood changes, becoming sad or anxious, having panic attacks are often seen as early warning signs. And unexpected patterns of behavior, doing something unusual, are things that we need to keep in mind. Now, I would like to mention that this is not for just drug abuse, but of other mental health conditions. However, because there is so much of interaction and commonality between other mental health problems, like, say, depression and anxiety disorders, with addiction, that it is important for us to be aware that there are certain changes which are warning signs, and that all students need to be aware of it. When we look at the common reasons for use of a substance, students have reported factors such as enhanced performance in academics, which is very paradoxical, because they're also using it to improve their functioning, for example, during an exam. But at the same time, it is also something that finally reduces their performance academically and brings it down. It could be used in terms of enhanced performance in sports as well. For example, anabolic steroids are used by the youth. It could be to escape from pain, from stress, from boredom. And by pain, I actually mean psychological pain. If there has been a relationship trauma or something has ended, there is grief in the background, or there are stressors of daily life. There are, say, for example, courses they need to complete. There are extracurricular activities. There is problems at home. All of this is are considered to be common reasons for usage. Fitting in and belonging to the group is a common factor that people bring up. As is curiosity with each substance. It is not only with alcohol or marijuana, but even other substances. Just this question of how do I feel when I use this? What happens to my body? For example, if I take ecstasy, what occurs within me? And why is it that this broadening, so called, that happens in terms of consciousness is something that can be attributed to a curiosity. And sometimes it's just to get a high, or because they are feeling bored and want something new and different in their life. I have to mention that consequences can occur in three areas which are different. It could be because of intoxication, that is when they are under the influence of a substance, or because they have overdosed on a substance or during the withdrawal. And I'll be talking about each of these in a bit of detail subsequently. I'd like to still mention a little bit about risk factors associated with substance use disorders. It is true that there are early warning signs which are associated with substances, but we also need to see and factor in risk factors which any individual would have. Now, it is again not necessary that these risk factors will lead to an addiction, but they definitely, across large scale studies, have indicated that there is a connection between these risk factors, or at least a cluster of these, or a combination with substance use in the future. These include easy access to different drugs and substances. For example, you see there are so many shops where an individual can go and easily get a substance. In fact, we say that every colony or locality will have as many hospitals as there would be substance selling that occurs, or shops that sell, where there are sale of substances. Peer pressure is a very well known and documented reason, which is a risk factor, as well as close friendships, where they feel that they will belong only if the substance is there in the picture. And in this belongingness, it would be something like, if there is a group of five friends sitting together, then there are cues that if one person is smoking up or drinking, then the other people also tend to do the same thing because of factors such as increased acceptability. There are also transition periods that happen in every person's life. Transitions would be in terms of moving from, say, a school to first year of college, to second year, to third year, and finally coming out of the college. So each of these are stressful time periods for people, although there is novelty and there is a newness to this in terms of greater capacities, greater experiences, and opportunities. But at the same time, it can also be stressful. For example, if the person is not able to adjust at that time, or there are new set of peers, these transition periods become vulnerability factors. Another vulnerability factor is glamorizing the use of drugs. I think there is so much debate going on about legalization of cannabis outside of India, and there are so many songs, and Bollywood again has n number of movies as well as songs which are specific about alcohol use, but not in terms of adaptive or problems associated with substance use, but more in terms of something that is common, and it is just seen as acceptable within the community. Another vulnerability factor is early age of onset. it has been found that people who start in their teens tend to move into a use and then a dependence pattern fairly quickly, as has been shown by longitudinal research that we have done in India as well as in NIMHANS. There is also a vulnerability of having childhood adult hyperactive attention deficit disorder and hyperactivity. We have found commonalities between this and addiction in the future. So, if a person has difficulty in sustaining attention at a task, in being in one place for a long time, tends to zone off when long conversations, has divided attention. If these factors come into play, then it is a vulnerability factor. There is ADHD in the background that, associated with mood disorders such as depression, are some things that we want to consider, because these are vulnerability factors for developing. And to give you an example of a survey that we had done, we found that people said things like,
Hello.
yes, I think I got muted in between. Am I
Yes,
audible
ma'am.
now?
Sorry for 30 seconds, so we got disconnected due to
All
network issues.
right.
Yes, ma'am. Please
Okay,
just repeat this slide, ma'am.
sure.
Thank you.
Yes. So I think so far I was talking about risk factors, which are more like vulnerability factors to develop an addictive disorder. And these include easy access and availability of substance use or any substances. Like if you look at tobacco shops or alcohol shops in Bangalore itself, there are n number of such shops. I think the hospitals are fewer than the shops that are there. And another thing is the kind of friendships that people have. And if they are substance using friendships, then even if a person does not really have a need to take a drug, but by virtue of just a friends being drug using, it just becomes something which they go on to. And that's what we call as peer pressure and increased acceptability among people in campuses of certain drugs such as marijuana. There are certain also in an individual's life, for example, moving from schools to colleges, different classes, having different relationship status, being single to being involved with someone. These transition periods are stressful periods for people because there are certain significant adjustments that need to be done at that time. Drug use has also been glamorized in the Indian context. The number of movies where individuals using drugs, including smoking and alcohol, is seen as something that is acceptable. Similarly, there are a lot of rap songs that are used and sung, and what happens is that these get planted in people's minds, these kind of songs and movies. And instead of telling us about moving away from drug use, it becomes more acceptable. Early age of onset is another risk factor. We've done longitudinal studies in this and found that people at the age of 30 plus, uh, discussed that they had an earlier age of onset. So although this is an age which is okay, before I say anything, someone has mentioned that my voice is echoing. Is that happening with others as well?
No, ma'am, it's perfect with others. Just
All
we'll
right,
confirm from others. Thank you.
sure, sure. A important marker or a vulnerability factor is having developmental attention deficit hyperactive disorder. Now, if a person has this disorder which has been detected, where there is difficulty in attending to tasks, having difficulty with sustained attention, difficulty in sitting in one place for long, or moving between one thing to another before completing the task at hand, then I think ADHD is something that we have found is associated with addictive disorders in so many studies, and that's what we found clinically also, that we need to look at the overlap. In fact, there are research that suggests that there are some common mechanisms between ADHD and addictive disorders. So if you know someone who is having this or is having depression, because mood disorders is the second most common psychiatric condition seen with addictive disorders. If you are aware of someone who has this, then I think discussing with them that this is a potential risk is important. There are certain myths as well, which are risk factors. For example, people saying things like, "I can handle 2 drinks and it's not going to be a problem. I can take 3 drinks and I can still drive. It's not an issue. I'll be fine. I can take as much as I want, but I don't get buzzed like others," are things that we need to address and look at, as well as lack of resources and knowledge about what is addiction. Like I mentioned, there are specific criteria like intense craving and salience and withdrawal symptoms, which are essential to have knowledge that is being disseminated to people like you all. There is also a risk factor in terms of decreased support, whether it is from family, friends, or from the community at large. Or let's say that the family has a history of someone using substances, so they become role models for you to also use a substance. Or there is a significant trauma in the background, including from the family, where there's been exposure to parents who fight with each other, or there's divorce, or there has been death of a loved one. These are very, very traumatic experiences that impact the identity of the person using the substance and makes it easier for them to use it as a way to cope with the trauma and the lack of supportive attachment figures in their life. Also, if you club it with positive outcome expectancies that they have had in the past, this is important, because if they have used a substance and it has given them the kind of effect it wanted. For example, they've used a painkiller and now that painkiller was effective, so they use it again and in a greater amount. But at the initial part, at least, the person was getting a good effect and therefore continues the usage of any of these substances or addictive problems that they have. We need to be a little mindful of it, that the first time the person uses or is exposed to a drug is still at a used level, but continuous chronic usage of this becomes a disorder. I work in the area of personality and addiction, and this is something that we have found across India and through NIMHANS, that there are specific personality markers that are unique to substance use disorders. One is impulsivity, that is giving in to something without thinking about it. The person jumps into conclusions, jumps into behaviors immediately without thinking about the pros and cons of that action. For example, let's just think of it like a person who has been given a substance. Instead of thinking about whether they should use it or not use it, or in what quantity it should be used, they just take it without thinking about the consequences. The other is a person who's temperamentally having, or in terms of personality, having certain risk factors, such as high risk behaviors. So this is not only for addiction, but even other behaviors. For example, getting into high risk situations, or situations where there can be trouble, having multiple partners without thinking it through, or going on a binge, or speeding, bungee jumping, getting tattoos without thinking about the consequences of what type they want. I'm not saying these are inappropriate, but in the context of addiction, there is a dysfunctional aspect to it. There can also be novelty and sensation seeking personality markers, again, wanting new experiences, which substances can provide, is something we have found. This also is not necessarily a problem, but in connection with addiction, it can be. Harm avoidance, rejection, sensitivity, and hopelessness come in the other side of the spectrum of identity. The first side is more of acting out, whereas the second part is more of how the distress is experienced internally by individuals. Harm avoidance basically is a temperament where a person tries to escape from any situation where there will be anxiety that will get provoked. For example, talking or having a debate in front of other people or superiors, or doing some chores which they feel anxious about. If they have this, then it could be associated with substance use. If there is sensitivity to being rejected by others, for example, if the person takes a simple word or a sentence a person has said in a relationship and thinks this is personal to me and I am being rejected, and chewing over it for some time, then the person has rejection sensitivity. And if the person has a tendency to get depressed over different things or minor things also. So I would like you all a little bit about the neuro. Am I visible and audible?
Ma'am, we lost you from the previous slide. Just sorry,
Okay,
ma'am. Sorry, due to network issues, there is some trouble.
okay. Previous
No-
slide. Let
Now
me
we
go.
now we got connected, ma'am.
Okay.
Yes.
So this part is, I think I had covered
Yeah,
it.
yeah, you have covered
Yes,
it, ma'am.
yes. Just a little bit about the neurological underpinnings of how substance use develops. If you look at this, the youth brain is often compared to a motorcyclist who is speeding and doesn't have so much controls in place, is more into just excitement and the high that comes in a high racer, like say a Harley Davidson or a bike. Whereas an adult brain, in this case, the photos of a Mercedes, is something which is more smooth, slower, takes time to see how much brakes are required. I won't talk too much about the neurological mechanisms as such, but I will just mention that there are certain reward pathways that are there in the brain, which are associated with deeper levels such as the limbic system and at the cortical level in terms of the prefrontal cortex, which is the response inhibition part or the reaction formation part of the brain, which makes decisions. Now, these reward pathways exist for all individuals, and when a pleasurable activity occurs, then the pathways get activated and dopamine is released as a neurotransmitter. And this leads to a feeling of pleasure and joy. For example, if a person has something nice to eat or drinks water, is meeting someone whom they like, is exercising, these reward pathways get activated and these are considered to be natural. But now imagine if the person is taking cocaine and this leads to 100 times fold uh, activation of pleasure, and the reward pathways are activated instantaneously. In that case, the brain gets trained in such a way that it will react to getting pleasurable sensations through dopamine release through these substances, because it's a quick method of getting the same rather than the natural ways in which a person could get it. So when we are actually doing any intervention, we are also trying to do a lot of cognitive work, and pharmacological intervention is essential because of these changes in the person's brain chemistry. I would like to talk about a quick assessment that can be used in college settings, which will help you all to understand if any of you, your friends, or anyone else in the younger population has this. This is called craft. And I'll just read out the questions to you. Have you ever ridden in a car driven by someone, including yourself, who was high or had been using alcohol or drugs? Do you ever use alcohol or drugs to relax, feel better about yourself, or fit in? Do you ever use alcohol or drugs while you are by yourself alone? Do you ever forget things you did while using alcohol or drugs? Do your family or friends ever tell you that you should cut down on your drinking or drug use? Have you ever gotten into trouble while you were using alcohol or drugs? So if any of these you have said yes to it, or your friends say, and there's a cutoff of more than two, then the person is someone with harmful use and needs to come and get some counseling. Very broadly, when I talk about the consequences, and there are so many that it's difficult to list them in a brief talk like this, and I would be happy to discuss the consequences in more detail later. But some of the common consequences are neuropsychological impairments, the capacity to make decisions and judgments appropriately. In fact, cannabis use disorder has been associated with decrease in IQ itself, which is something that the common population is not really aware of. There are difficulties in inhibiting the responses or reactions. Impulsivity is seen in terms of neuropsychological impairment, attention, concentration, memory, short-term memory, long-term memory have been found to be impaired. There are significant legal consequences, and I would suggest that you look at the different acts that exist for addiction, specifically in terms of whether an individual is having a substance in their hand, in terms of what that would mean. A lot of accidents and injuries are associated with any kind of substance use. For example, while driving, if a person is intoxicated or falls, college dropouts because of the intoxication and decline in academics are frequently seen. The substance itself causes a vulnerability to develop other psychiatric disorders. This could be either a personality disorder, or it could be something like a mood disorder, or some kind of anxiety. When I say vulnerability in terms of a personality disorder, I mean things like a sense of emptiness, meaninglessness, multiple relationships, going from one to the other, uh, a feeling that they are not being loved, or getting extremely judgmental or suspicious of other people. uh, Personality problems like having very rigid rules and regulations and doing things in a very structured way. These are different types of personality disorders which often come coexist with substance use or even antisocial behaviors like harm doing to others. There is a lot of social discrimination that people with substance use experience. We need to go beyond the college population and look at how you all would be treated outside of your college campus in terms of the family, clinical group, primary mental health care settings, etc. There are family conflicts because the roles of different people come into play. For example, if the person has to take care of certain family responsibilities, they're not able to do that or fulfill role obligations. There are emotional dysregulation problems as well. And tolerance of painful emotions becomes difficult. The health consequences are very well known in terms of physical health. And I think people are aware that there are more than 7,000 chemicals in tobacco, out of which at least 70 cause cancer and other health consequences, whether it's the kidneys, pancreas, etc. There are significant problems which lead to inpatient and emergency hospitalizations. Although to a young population, this does seem a little far off because it's in the future. But if you look at whether there are some immediate problems that you're having, which is associated with substance use, you could take that up for the future and prevent yourself from going into this stage where there are health consequences. Economic losses are very well known. If a person is spending, say, 500 to 1,000 rupees a day on a substance, you can think about the amount of financial burden the person would have over a period of time. I'll quickly talk about management of addictive disorders from a youth perspective. So I'm not going to be touching up on the different kind of interventions that exist at a hospital level, but I think it's important for you all to know that we have very clear addiction specific psychological interventions that you could ask me about later. What I'm going to talk about are some broad things that can be done. And I would start by saying that there is a protocol that we follow in terms of the kind of intervention. If it is a very mild usage, it has not gone into a severe level, then we do more of what I'm doing today. Is more in terms of prevention, building knowledge and skills among the youth, rather than going into a brief one-on-one or group intervention that occurs at a moderate level or the person is using more of the substance. Brief interventions generally are more in terms of giving brochures, handouts, explaining about the ill effects of the substance, explaining about other mental health problems, how a person's stress levels are increasing, or how worries and anxieties are having an impact in the individual, and teaching them some basic skills of dealing with the substance. But if it goes into a dependence pattern or there is severity, then we have specialized hospital-based and clinic-based treatments where the people need to be referred to us, and we work with interventions known as relapse prevention and cognitive behavioral therapies. We have motivation enhancement therapy that I'll also talk very briefly about, and several other treatment packages that are given for people. So what I'm trying to just say is that at any given point, youth has a lot of resources that can be utilized to help improve their day-to-day functioning. If there is, like I had mentioned earlier in the former slide, a person who is a low risk user, we have a treatment known as frames, which is very brief. It can be done by counselors, nurses, staff members in a single or double session, which basically includes giving feedback to the person about what are the consequences of their using the substance and how much they used it. let the person have ownership of responsibility and acknowledging that they've been using it uh, for whatever reason, whether it was stress, but they need to have that ownership rather than blame it on circumstances. Then giving advice such as what can they do to actually reduce the number of substances or problems associated with it. Um, Looking at the menu of options that are available that they can utilize in a very empathetic and manner and non-judgmental manner, so that the person's self-efficacy or the capacity to get the outcomes they want is enhanced. You can start with a STAR plan, which basically is set a quit date within 2 weeks, take support from friends and family, anticipate challenges that could come, and remove all substances using a technique known as abstinence sampling, which basically is that if a person wants to quit tobacco, they start off by saying that this is the basic time period, say 1 day, even if it's just 1 day, that they can be abstinent from tobacco. And if they are, it increases their confidence to make it 2 days of quitting to 3 days. So gradually over a period of time, it becomes easier for the person uh, to quit the substance. There are very quick 4Ds that we follow. Delay, which is if you want it now, delay for a little time. Distract yourself doing something else. Take 3 deep breaths and drink water. When you're looking at motivation to change, motivation is one of the main things that we look at for quitting, because motivation is the reason why people do not also take treatment, because there is a tendency to think it's no big deal or I can quit on my own whenever I want to. But motivation can be developed, and there are several ways in which a person can be motivated. Just try to think about the different stage an individual is in the cycle of motivation, where a person may be in a stage where they don't want any change, they don't want to quit. It's called pre-contemplation. Or the person can be ambivalent. I want to change, but I'm not sure when, I'm not sure now. I have reasons to quit, but I have reasons to stay in the situation. And then comes the other stages called preparation, action, and maintenance, in which the person is making plans but not sure how to do it. They doesn't have the strategies of quitting, to learning those strategies and steps of doing it and making sure that the changes are maintained. This is a simple thing that a person can use. It's called a change plan worksheet from the motivational interviewing strategies. One can do it immediately. Like just mentioned, the changes I want to make are what? The pros and cons of using the substances are again what? Feeling high, feeling relaxed versus losing money, friendships, hygiene. The reasons I want to make the changes are again what? It could be doing better academically, being connected with a larger circle of friends. What are the main goals that I have, and the people who can come and help me in my goals, like counselors, peer leaders who don't use the substance. There are several other psychological techniques to quit using. I'm only going to touch upon one or two. If there is intense craving that is there is a technique called TIP which we use, in which the person uses temperature regulation. For example, if the craving to self-harm or to do something is intense, at that moment, if you just use temperature, for example, cold water, and wash your face with that, it immediately activates the parasympathetic nervous system and you feel calm and the craving comes down. Or doing intense activity at that time, like going up and down the stairs or jogging immediately, or paced breathing, which is just deep breathing. At that time, the craving gets reduced. Developing a crisis survival toolkit is essential. This has things like self-soothing techniques, where you look at using the five senses, what pleases you in terms of smell and taste, like maybe having an ice cream or taking a good bath with all the nice smells associated with what you're using, or wearing nice clothes, going for an outing, having a healthy support network, and visualizations of you being non-substance using. is useful. We also try to avoid avoiding. So whatever you've not attended to or given up on, you stop avoiding that and get back to it. And there is another technique called ABC Please, where you accumulate a lot of positive experiences. So if you do things like maybe a crossword puzzle, reading the paper, taking a dog for a walk, having a relaxing bath, having a nice novel to read, something to hear, something nice to see, these positives eventually help in reducing your negative mood state and taking away the impact of substance use. In this, coping ahead is also important. If you know that when you're going to be with friends who will use a substance, at that time, start coping ahead of how you will say no to the individuals. Or if there is a stressful experience like an exam or a relational crisis, coping ahead in terms of what an individual needs to do is important, along with balanced eating, good exercise practices. There are several things one can do as long as you recognize that there are available resources. Use social media, create brochures, celebrate mental health, and put tobacco dates in substance use population. There are several youth-friendly services which are available. I can discuss this in more detail, but at a adolescent primary healthcare setting, there are dedicated AFHCs, which are friendly health centers for adolescents at the community health center level, also in the district mental health level, at the taluka level. We have dedicated counselors, we have specialty clinics in different districts and medical colleges, and linkage with de-addiction facilities such as NIMHANS. All of these work with stigma and discrimination. Remember, if there are some gender problems also over here, women are said to experience double discrimination. One is because they're using the substance, and the second is because they are women and they have to take care of their household. There is, we address social support, financial and economic problems, like they've lost their money, housing problems, providing information, and developing a healthy relationship is what is provided in these centers. There are certain helplines and resources that people can use. I've just put that in. We have the Tobacco Quit helpline. There is a national free drug de-addiction helpline, cessation program helplines. There are certain websites such as SAMSA and NIAAA that can be accessed to get details about substance use, harmful use, types of substances. In NIMHANS, we have developed an addiction app which tells about the type of substances, consequences, assessment tools of addiction. And with that, I will come to a close of my talk. And the key takeaway from this talk was that the youth brain is different from adults, and the reasons why youth take substances are different, but addiction is treatable, and early identification is the key, and there are a lot of access to website and resources, and one should start utilizing it now. Thank you.
Thank you very much, ma'am.
Thank you very much for a very informative and scholastic talk on addiction. I'm sure students and adults who have joined this webinar will be highly benefited by your talk. In fact, you spoke right from what is addiction to assessment of harmful substance and consequences, management of addiction, the STAR plan, and 4Ds, and change plan worksheet, motivation enhancement. All this, I'm certainly sure that students will be benefited by your talk, and finally your takeaway message was also very useful. As Swami Vivekananda has said, anything that makes us weak physically, intellectually, and spiritually are to be rejected as poison. So addiction is to be, we should not be addicted to any substance. That's what is the overall view of this talk. There is one, Umesh, there is one question. No,
Yes, sir, I will check. Please go ahead, sir.
Everybody has appreciated your talk, madam. In fact, KSTA would like to organize many such talks for the benefit of young adults. Some of them have been addicted to smoking, cannabis, or alcohol. We want addiction-free society to build. So in future also KSTA will organize webinars and also physical talks also in our own campus we would like to organize. We'll be inviting you. On behalf of KSTA, I'm very thankful to you. And I'm very thankful to Bharat sir. Bharat sir, for your words. In fact, Dr. Bharat sir has been very helpful
Sir,
for me.
Sir, namaste, sir.
Words. Sir, namaskara. What
Namaste.
your words of
This is the first time actually I'm listening to Dr. Geetanjali. I'm very much impressed. This is an excellent topic that is pertinent to the youth and also within the purview of the viewers and audience today, organized by KSTA. Thank you, ma'am. It was very informative, and I hope KSTA will invite you again and again for providing such information relevant to the public and adolescents specific. Thank you.
Thank you, sir. And I look forward to having further discussions and interactions which are more specific in addiction
Yes.
with
Yes.
all of you.
Yes. Thank you.
Are there any questions?
How to distinguish between positive and negative addictions?
Positive.
Okay. Yes, that's very important because we often say that if a person is working a lot or if a person is reading more than they should, would that come in the purview of a positive addiction? I think the most important thing is in terms of the consequences and dysfunctionality, the severity of using any kind of behavior, because that comes more in the purview of behavioral addictions. But we always look at the problems that are associated with the usage or doing a certain behavior. If there are greater problems, then the techniques and interactions work will be similar.
One more question. Is there any difference between an addiction and dependence, or both of them are same?
Okay. Yes. Essentially, both are the same. Addiction basically can be in terms of abuse, harmful use, and dependence. Whereas substance use dependence is only at the most severe, and in terms of the hierarchy, it comes as the most extreme. I'd also mention that now addiction by itself, we are using the term less, and we use addictive disorders so that the label doesn't come on the person and we don't call the person an addict.
Thank you very much, madam. Once again, on behalf of KST and all the participants, we are very, very grateful to you for this very insightful talk. Thank you very much.
Thank you. Thank you very much.
I'm also thankful to all the participants who have joined for this webinar. Tomorrow, one more talk on technology addiction will be delivered by Dr. Manoj K. Sharma, Professor of Clinical Psychology, NIMANS. So all of you please join by 3 o'clock. The talk begins at 3 and by 4 o'clock like this. I'm sure all of you will be again benefiting. Thank you very much for being with us. Thank you.
Thank you.
Thanks, Bharat sir.
Thank you, sir. Thank you.